All right, we are continuing with chapter 9, and this is going to be 9C. This is the third segment for 9, and what I'd like to start with is just a little bit of a review or not review, but to finish up some information that I have on hearing loss. And then we're going to move into some information on vision and low vision and blindness. And then we'll finish up this section with autism. And then I think the next one, 9D, will cover traumatic brain injury. So let's begin 9C and just finish up a little information on hearing. Approximately half of the hearing losses that we see at birth are genetically based. And we know that hearing loss occurs in over 300 syndromes. It's very common in individuals who have been diagnosed with a syndrome of some sort. We know that between 14 months and 3 years, that's the average time that a hearing loss is diagnosed. And we also know that the majority of the visits to the emergency room for children are for otitis media, which you know is an ear infection. Now, remember back when we talked about the American natives and the Alaska natives, we said they had a higher than average rate of otitis media in their kiddos. And part of that could be due to how they live in such remote areas and are unable to get to a doctor when a child has an ear infection. There is poverty involved, individuals who don't have good jobs, low income, and so that may also contribute to the number of kids who don't get seen by a doctor and they have more otitis media. But otitis media is very common in children. And as we discussed when we talked about the anatomy and the physiology, this is partly due to the configuration of the eustachian tube. And kids just have ear infections. And it hopefully can be resolved with medication, but we know that sometimes that isn't the case, or it clears up with medication and they get it right back, which consistent otitis media, consistent fluid in the middle ear, can result in a hearing loss over time if untreated. When we talk about causes, of course it includes heredity, just like the 2 boys that I told you about that ended up with cochlear implants. The boys had the significant profound hearing loss, and the 2 little girls in the family did not. So there definitely is a hereditary component for them. They could not remember, or they did not know of anyone in the family who had deafness or a profound hearing loss. However, it could go back generations. But definitely it is the mother's genes, the father's genes, and for some reason that mixture of their genetic makeup resulted in their boys having a profound hearing loss. Infections can cause a hearing loss, such as meningitis, trauma, head trauma to the 8th auditory nerve, medication. Now, a lot of times we don't think about medication as causing a hearing loss, but I'll tell you about a young woman who had a viral infection. She was in her 20s, she's in her 40s now, and the viral infection was attacking her heart, and she was probably very close to death. The doctors used very strong antibiotics. Thank goodness she lived. And as a result of these heavy-duty antibiotics, she ended up with a bilateral hearing loss requiring hearing aids. The medication was ototoxic, toxic to the ear. And as a result of that, she did end up with a hearing loss. Now, that's a small price to pay for your life, but she did end up with a hearing loss. Now, because she was in her 20s, her hearing did not impact her language development, or her hearing loss did not impact her language development because her language and speech was already developed. So she was not impacted by that in terms of language development. Now, and her hearing loss, I don't feel was real significant. It did require bilateral hearing aids. What she complained about the most with her hearing was if she was riding in a car, she was in the back seat, and the people in the front seat were having a conversation. She could not hear the conversation. She could not discriminate the sounds that they were using. And you know, when you're driving in the car and you kind of turn halfway around and you're talking to someone, if the radio isn't on loud, you know what they're saying. And she was missing that part of the conversations. Now, looking at someone's face probably helped her quite a bit, even without her hearing aids, to know what they were saying. But she did experience some difficulty hearing in situations. Exposure to loud noise over time can also cause a hearing loss, such as working in a factory with loud machinery, a dentist who's using a drill for several hours a day, people who mow lawns professionally and they're mowing several lawns a day. Over time, that noise can cause a noise-induced hearing loss. The military servicemen and women coming back home, if they have been in a war zone where there are bombs going off, lots of artillery, and they're close by, over time, and maybe it's just going to be a short period of time, they may also have hearing losses when they get home. People who go hunting a lot with rifles, and those rifles are up close to the ear, they may also experience a hearing loss. And just with normal aging, I know my hearing isn't what it used to be, and I do have some discrimination with sounds. I miss sounds and I plug in other sounds, and I also feel like my high frequencies are beginning to dip a little bit. So just the normal aging process. The time at which we identify hearing loss in a child is extremely important. The age of onset of the hearing loss is also very important. It's critical to catch that hearing loss, as you can well imagine, very early, and the treatment needs to happen early. Early detection is extremely critical. When we talked about nature versus nurture and the nativists and the behaviorists, children learn by imitation. They learn by what they hear. And so if you can't hear sounds, words clearly as normally as we should, you're going to have somewhat of a hearing loss and a language impairment. You've got to be able to hear normal speech, normal language in order to learn it. The greater the hearing loss, the greater the language impairment. I think that just makes sense. And we've talked about the use of hearing aids, cochlear implants, maybe even sign language to supplement that hearing loss. Now let's move on to low vision and blindness, and this is on page 157 of my PowerPoint. And I will be giving you some additional information in just a couple minutes here. So this is the supplemental information, maybe something that you want to take notes on, because remember, I have additional information, and this will be, the final will be an open book test. So you will be able to use notes in your PowerPoint and the textbook. So taking good notes will be important. Plus, you'll be able to go back and review each one of the lectures. So that should be helpful to you as well. Visual defects can be the result of the same issues that cause hearing. It is not uncommon to find that there is a visual impairment in a child who has a hearing loss and vice versa. When we talk about visual development, I'm going to give you some supplemental information here. We know at birth that the child, the infant, is able to see somewhere between 8 and 10 inches, an average of 7.5. We know that they can't easily tell the difference between two objects at birth, and that they don't typically move the eyes well and track between two, two objects. But it's important for bonding with the caregiver, with the parent, by holding them in the mother ease issues that we talked about. So that 7.5 inches is important for the child to at least have some knowledge of movement, different shapes as they bond with the parent. As we move to the first month of life, the eyes are beginning to work a little bit better together, and vision begins to improve rapidly. We're beginning to see eye-hand coordination. They are tracking a bit better, and they're beginning to reach, and they're beginning to focus a bit better on the individual's face. The first 2 months, the eyes may appear crossed. They're just not well coordinated. The muscle strength isn't there just yet. But we don't want the eyes to turn in or out constantly. You may see an occasional movement in those directions, but we don't want it to be constant. They're beginning to follow moving objects with their eyes, and at 3 months, they're beginning to reach for objects. 5 to 8 months, eyes are working even better together. Color vision, good color vision, we see at 5 months. We're also beginning to notice that when they crawl and beginning to crawl, and we want them to crawl, that is a normal developmental sequence that our youngsters go through, and we want them to do that. I know some parents want them to walk early. I don't know if they think they're smarter or whatever, but they really do need to crawl, and we want them to go through that reciprocal crawling. It's a normal developmental skill that they learn. And this crawling helps develop eye, hand, foot, and body coordination. It helps with some gross motor movements. 9 to 12 months, they're pulling to stand. They're practicing standing up. At 10 months, they have a pincer grasp. A pincer grasp. And what are they picking up? Cheerios. They're picking up Cheerios. Now, at this time, you also have a safety issue. If you have small objects on the floor, if you've dropped a penny, if you've dropped a bead, if you've the dog food, they'll go to the dog food bowl, and if it's small little pellets, they'll be putting the dog food in their mouth because they're practicing this pincer grasp. So making your home safe, taking those measures of cabinet doors and drawers, and making sure small things aren't on the floor, because this pincer grasp we're beginning to see at 9 to 12 months. They're now trying to walk, and they can judge distance fairly well, and they're pretty good at throwing things. So their aim isn't too bad. By the time they're 2, we have good eye-hand coordination and depth perception. That should be well developed. Now, as we think about troubleshooting, and if we see that there's excessive tearing, that could mean that the tear ducts are blocked. If there's red or encrusted eyelids, that could mean there's an infection. If there's constant eye turning, constant, again, there's maybe some trouble with muscle control. Extreme sensitivity to light could indicate elevated pressure in the eye. And the appearance of a white pupil or a white dot in the pupil could indicate cancer. A lady that I worked with years ago, I'll call her just an acquaintance, her daughter had eye cancer, and it was the white dot that was noticed, and she had both eyeballs removed. Her daughter grew up, she had a baby girl, and my acquaintance was looking at those eyes closely and wondering if she was going to have eye cancer as well. The child went to Riley, the child was examined. The doctors didn't think that there was a problem. They didn't see any kind of white dot. Sent her home with a clean bill of health, and my acquaintance friend continued to watch her closely, and lo and behold, she saw the white dot, the white point at the pupil. Now, the little girl aged out of First Steps. I was no longer making weekly home visits, and I really don't know what happened. So there was that genetic factor, for sure. Mother had eye cancer, and now the little girl was going to experience potentially having her eyeballs removed. But as I say, I'm really not sure what happened. So low vision and blindness, it is the vision component is important for joint attention, mutual gaze, using gestures, learning sign language. It's just another avenue for getting your wants and your needs known. Now, we know that it can also impact vocabulary development, but also reading facial expressions. If you don't see well, you're not going to be picking up social cues from looking at somebody's face. Remember, you can say something in different ways. I really like your hair today, and it could be a mess. And the face could even say that. I really like your hair today, and you have a big smile. And the babies need to see that. Our little ones need to be able to read those visual cues. And if your vision is not good, it's cloudy, whatever you see, it will impact that pragmatic development for the child as well. So early intervention is important, educating the parent is important, and providing additional stimulation. Now we're going to get into developmental disabilities and intellectual disabilities. A developmental disability will be diagnosed before the age of 22. And I would say nearly 100% of the time, developmental disabilities will include a speech and language disorder. They may be also delayed in fine motor movements using their hands, buttoning, taking pants down, pulling pants up, tying your shoes is a fine motor skill. But they may also have gross motor skills in which they were late walkers. But developmental disabilities, for sure, speech and language problems. Again, we have to consider the age of identification and intervention. I think we're better at identifying developmental disabilities through the First Steps program. Not everybody gets into First Steps. They too have a criteria, just like the school system, when they're looking at who they will include in that early intervention program. Also, with First Steps, you go into the home, or you go to the daycare, or the babysitters, or wherever the child is, that least restrictive environment. But we want parent involvement. We want the carryover. It's a parent program. I know what I do and what I did in First Steps was important, but I'm not silly enough to think I'm the only one who's going to do it. It needs to be a combination of people involved. There need to be consistent visits. Those parents need to be home when I say I'm coming. It needs to be consistent attendance, just like anything, just like coming into the clinic, just like going to school. You need the consistency. When we talk about intellectual disabilities and language impairment, there is a connection. Remember, I've talked many times about how language and cognition run parallel. They run together. The greater the intellectual disability, the greater the language impairment. And vice versa. The greater the language impairment, probably the greater the intellectual disability is. Again, educating the families and the caregivers as to how they can provide that additional stimulation is very important. Developmental disabilities, they're very broad because of so many different areas that it includes. And intellectual disability is on a continuum, and it's fairly broad as well. According to the American Association on Intellectual and Developmental Disabilities, intellectual disabilities occur when a person has significant limitations in intelligence as determined by an IQ test with an IQ below 70. And they also have limitations in adult daily living activities and skills. They have conceptual skill problems, they have social skill problems, and the adaptive or the activities of daily living, their adaptive skills include, and I'm thinking of as an adult, and even with a child, dressing and undressing, bathing, knowing when your clothes are dirty, knowing when something's on your face. In adults, they may move into supported living and have a job coach. Do you know that you need to use deodorant? Do you know how to write a check? Do you know how to budget your money and go to the grocery store and shop and only get what's on your list? Do you know when food is bad in the refrigerator and you shouldn't eat it? Can you keep your apartment clean? Can you fill out an application for a job? So those are the skills that keep us functioning every day and keep us working and being presentable, and in that case of clean clothes and shower and smelling good, people want to approach us then. If we're not presentable, people kind of shy away. I know there was a young man who was bagging groceries at Payless, and there was such body odor when I got closer to him down at the end where he was sacking my groceries. And I thought, ooh, buddy, somebody should talk to you because people are going to complain. You'll lose your job. But it's that recognition of what I need to do in order to function in society. With intellectual disabilities, the intellectual disability gets diagnosed and occurs before the age of 18. And the language impairment may be the single most defining characteristic of the intellectually disabled population. Language and cognition, they run parallel. We know that children with an intellectual disability, they're not good conversational partners. They're not good at turn taking. They don't understand figurative language and abstract concepts. Their sentences are very simple. Their vocabulary has been compromised. They don't have a very extensive vocabulary. They don't always comprehend what you're saying to them. So you may have to break down an instruction into very simplistic terms. You may have to repeat it numerous times and practice it. You may have a schedule, picture schedule up of how you clean your apartment. So they will need lots of help in living independently. Sometimes they have roommates. Hopefully, one roommate isn't messing, the other one's very neat. Sometimes having that roommate, they can kind of work together on things, and there will be more than likely numerous articulation errors, which makes them maybe unintelligible. The articulation is very conspicuous. So we're just globally seeing more problems, or to a more extensive degree, with the intellectual disability. So those two terms certainly will be on the exam, and characteristics of each. Now, we're going to talk about autism spectrum disorder. We all know what that is. We've all had experience, I suspect, with a child who is on the spectrum. And according to the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5 is what we're going to be using. Now, the DSM-5 is the new version, and I think it's been out since 2013. Prior to the DSM-5, we had autism spectrum disorder, we had Asperger's, and we had PDD-NOS, which is a pervasive developmental disorder, non-otherwise specified. And the PDD group comprised those kiddos who maybe didn't meet all of the characteristics of autism. They weren't Asperger's, but certainly they looked like they were autistic. The characteristics and the information that the parent was sharing, they appeared to be autistic, but for some reason they didn't meet the strict criteria. Well, today we're just looking at the umbrella of autism, and everything falls under that. So we don't have the same categories as we did before. Now, we know that it's a social communication disorder. They have interaction deficits. It can be receptive, comprehension, what goes in, as well as expressive, their output. They have repetitive or restricted patterns of behavior. The onset is in early childhood. You just don't get diagnosed with autism when you're 15. However, I do know of an individual who was diagnosed with Asperger's. This was before the DSM-5. High-functioning autism. The child was struggling in school. Somebody said, well, what do you think? Could he have Asperger's? Had the child evaluated, and lo and behold, the diagnosis was Asperger's. I've also heard of individuals, adults, who later in life got a diagnosis of Asperger's. Now, I don't know if it's because they had a change in a job, in a relationship, something happened to trigger somebody to say, do you think? And then they were evaluated, and sure enough, they got the diagnosis. But today, we can diagnose autism so much better, so much quicker, so much earlier. And I think that's what's made the change in the statistic for 1 in 65. I think our textbook says 1 in 88. My information says 1 in 65. But it's because we can diagnose much better and much earlier. Our pediatricians and our doctors are so much better at using checklists. I know the doctor I go to, she's a family practitioner, and she uses a checklist to screen for autism. And I think doctors are also listening to parents and asking parents questions. So the diagnosis is changing, or the numbers are changing. It's been pretty steady, I think, at 1 out of 65. There's a significant impairment in functioning in contextual situations. It's sort of like reading social cues. and they have other developmental disorders that do not explain the disturbances that we see. We know that with some of the, the, the unusual patterns of behavior, they have very narrow interests, these kiddos. They know everything about dinosaurs. They know, I know a young man who can spew facts about presidents and about a certain war, and that's what he likes to talk about. He also likes to talk about Jim Carrey movies, and he can tell you every movie that the comedian Jim Carrey has been in. He can spew out dialogue from certain movies, that the dialogue that he thinks is really funny, and he will even speak like Jim Carrey. And I will tell you, he does not like it if somebody says they don't like Jim Carrey. One time, he's notorious for coming up, maybe tapping you on the shoulder, and you say, "Oh, hi," and he goes, "Hey, do you know what movie this is from?" And then he's loud, and he gets into this Jim Carrey persona, and he spews out the dialogue, and he's got his face like Jim Carrey, and his voice changes, and then when he's finished, he goes, "That's funny, isn't it?" And you're just standing there, and he talks really fast, and you have no idea what he said. Well, I made the mistake one time of saying, I really don't like Jim Carrey so much. And he was mad at me. "Well, what do you mean? Everybody loves Jim Carrey. Jim Carrey's really funny. What's the matter?" And I said, "Well, it's okay not to like Jim Carrey. He's funny, and I know people really like him, and I know you do, but he's just not my favorite. My favorite is," and I said a name, and he came right back to Jim Carrey, and when he did not like what I had to say, he turned around and walked away. And he gets very wrapped up in the persona of Jim Carrey. He, as I said, is very good with history. He wants to go to college, and he wants to study history. Okay, well, he's going to need some services that are going to help him do that. And I suspect that he's only going to want to talk about the history that he likes of a certain era, a certain period of time, or a president that he really likes. And when the topic gets on something that he's not interested in, that he doesn't know about, I suspect his attention will waver. I'm not so sure that he could write a paper. Maybe he could, but that's a pretty heavy-duty language skill to generate a paper at a college level. He does drive a car. He took the driver's test 3 or 4 times and almost passed it each time. It's written. He has to read and answer questions. The last time that he took it, he did pass, but the instructor at the DMV allowed him to answer. She read the questions and she allowed him to answer, so he didn't have to write it down, and he passed. So in that case, what are we measuring? His ability to read and write and comprehend, or his ability to drive, to be a good driver? And I think he is a good driver. But those narrow interests, he loves to twirl hair, and when he's tired or a bit stressed, he does that. Not like he used to. He used to do it a whole lot more, but he doesn't do it quite as often as he does now. Used to be quite afraid of storms, and even today, if the clouds get dark and the sky looks ominous and the wind kicks up, he's watching the window because he's afraid, and he's worried about what might happen. In 2012, the Centers for Disease Control and Prevention gave the statistic as 1 in 88 children, and it's 5 times more common in boys than girls, which we know, but my statistic is 1 in 65. That's not going to be on a test because there is some conflicting information there. And we don't really know what causes autism. We really don't have one definitive answer. We know it can be genetic. We know that there can be more than one child in a family with autism. There can be 2 or 3 siblings with that diagnosis. In the case of the young man that I spoke about, he has a cousin who is, I don't think he got a diagnosis of Asperger's. I do think this young man does have a definitive diagnosis of autism, and there is also an intellectual disability as well. Also, I think the young man that I was talking about, older brother could be on the spectrum as well, some similar behaviors. So we know that there is a genetic component. We also know there can be an environmental component. And we also suspect an autoimmune disease. But we really don't know what causes it. If the child isn't talking by the age of 5, the prognosis is poor for language and talking. As a speech pathologist, I'm a little concerned by 2. Now, not that they're not speaking, they're not oral, but I want them to have some way to communicate. I want some oral speech from them. We know that ABA, applied behavior analysis, is the treatment of choice. They spend every day, all day, with a trainer, and they're working on being able to communicate more effectively and to manage behaviors better so that they can go back to a traditional school. Any training for autism should include behavior management and education. We know that they can have a problem both in receptive and expressive language. They have difficulty with mutual attention, initiating conversation, and initiating requests are difficult for those kiddos. And sometimes in therapy, we will even write a goal to work on requesting. Poor conversational turn taking, very limited range of communication function, difficulty with abstract words, poor word retrieval. We've got a memory component sometimes, trouble expressing emotions, and the least affected area is phonology. We're not really seeing articulation here. So I know you've had lots of information about autism, but this is the information that was in our text, and this is what you'll be evaluated on when it's time to take that test. Okay, we're going to stop there after autism spectrum disorder. What we're going to start with in the next one will be TBI. And I encourage you to make sure you have paper and pencil so that you can jot some extra notes, because I do have quite a bit of supplemental information for you. And if you write those notes down, you're going to have them for the open book final. All right, we're going to stop now, and I will see you after a while. Bye.